morning. Morning. Start. Okay, let us sit for now. This is for 1 minute pause, please. The 2 minutes, please. Okay, yeah. Okay, let's move on to our class today. Today we talk about the mindfulness in hospital setting. So this is the question. So most of the question here may relate to the thing we discussed before, right? Like the DBT or ACT. Okay, let's move to number 1. What is number 1? Oh, number 1, number 2 relate. What do number 2? No. Oh, okay. Okay.
I was supposed to do number 2, but I switched right before we left because like 3 other people wanted to do 2, but now I guess none of them are here, so I should have just done it anyway.
Okay. I think number 1 and number 2 they delayed, and this is it's so obvious as we learned before, right? For the MBSR, for the secular therapies that could be helpful to improve the well-being of life, and I think we don't need to talk more about these books that talk in detail. This is what we call clinical handbook of mindfulness. This is called all the benefit of using the mindfulness in the clinical setting. They have to deal with a specific disorder, what we talked before, right? Obsessive compulsive disorder, we talk sometime next week. Depression, we talk about that. Borderline personality disorder. We have not talked about eating disorder, but similar addictive disorder we talk more. So, with ADHD, so basically this is related to number 1. So I just want to emphasize again, I don't know, 2 and so on. So let me show you a short clip.
Mindfulness is awareness.
So this.
Hello, I'm Dr. Diane Reibel, and I'm the director of the Mindfulness Institute at Jefferson Myrna-Vrin Center of Integrative Medicine. Mindfulness is awareness. It's present moment awareness. It's about being here now and opening to your experience with curiosity and kindness. Through mindfulness, we become increasingly aware of what's happening in the present moment without being stuck in thoughts about the past and what should have happened and what could have happened, and without focusing a lot of attention on worry and concern about the future. So we stay present, and in that way, we cope with what's happening in the moment while it's here, and then we let go and move into the next moment. And in this way, we reduce our stress. Well, through mindfulness, what we do is turn toward what's happening in the moment, rather than being lost in thoughts about the past or the future, which is oftentimes where we really get caught in anxiety. So by continuing to come back into the moment and having skillful strategies to work with what's happening, stress is reduced.
And when you notice the mind wandering off to thoughts about the past or future, just notice that. There's no need to judge it. And whenever you notice, you gently but firmly bring the attention back to the breath, wherever you find it in its cycle.
This is at the
It's so rewarding because of what we do. Every person who has a job here, but we all know it's challenging because this is a stressful environment. So the question for me personally that drew me into mindful practices was, how am I going to make sure that I am aware of stress in my life? And the question is, so mindful practice is just a wonderful tool for dealing with that stress. Every Thursday night in the chapel, we take half an hour, and a lot of it is just silence, just being. whether I'm in the hospital, whether I'm playing tennis, whether I'm at home with my brother, with my wife. It's like those moments. It's about one of the things that again attracted me to mindful practice is this is for everyone. It doesn't make any difference what faith group you are from, whether you have faith or not. Mindful practice is about taking your values, your belief system, and incorporating this tool into that practice, which only enhances who you are as a person. If you spoke to each person here, it's amazing, sort of like the testimonies of how just something as simple as breathing releases some of that stress and helps you to come back to where you need to be in that moment.
Okay, so again, this is something we went over before. So that's why I ask you, which number you to do? Which number you supposed to do?
I think number 2.
Okay, you are now. You're on the spot. So what do you want to talk about?
I talk about sleeping disorder because usually, like for college student or everybody, like go to work, if we don't get enough sleep, so we cannot work and concentrate. So really bad memory. So actually, like mindfulness, like usually like reduce your stress because they talk about like every time if you're so stressful, it's really difficult for you to fall asleep. Or sometimes you think about you fall asleep, but you usually like wake up at midnight, or sometimes like you're just sleeping and you wake up every 2 hours. So they talk about like you should like do meditation and relax about like 10, 15 minutes before you go to sleep. So actually like relax your mind, so it's more easy to go to sleep instead of not getting enough sleep, or you have to like wake your mind in the middle of sleep.
Sometimes you drink too much coffee. It may keep you awake. Is it right? And especially when we talk about body scan, if we have problem, we talked about before, of sleeping, we can do body scan. Did you do it? Did you try? You try?
Try. I get lost like past my neck. I totally lose focus. I'll start here and here and be like, okay. I can't get through my whole body. I just lack of patience or something. I just can't keep going. I'm like, okay, I'm bored now.
Oh, really?
I have trouble just doing the whole, I don't know what I'm supposed to do. I get lost or something. I do better with the breathing.
Remember the instruction when we talk about body scanning?
Yeah. So, I think it works for me as long as there isn't anything else going on that might be affecting my sleep.
Mm-hmm.
Like last night, I couldn't sleep at all, and I woke up at 4, and I didn't get any sleep. And I was trying to meditate, but I'm guessing the reason why I couldn't was because I had coffee and 2 cups of black tea around like 5 o'clock. And usually caffeine doesn't affect me, but I thought, well, why else can I get to sleep? And I also had a lot on my mind, so that's why I was trying to meditate. But then also, like when I tried to do a body scan, I was having a lot of pain in my neck, and so body scan just kind of like made me focus on that pain. I was like, okay, I don't know. I don't know what to do with your pain in your body. Like if you're supposed to focus on the pain, or if you're supposed to like not think about it, but then that wouldn't be body scan if you're not thinking about how your body feels. So if it goes bad, I don't know what to do.
Feel bad. That's the point. When you still think you feel bad, that just means somehow you reject that pain, right?
Was I rejecting the pain?
No, when you say that you feel bad about that pain.
I mean, it hurts.
Yeah, it's hurt.
Yeah.
Yeah.
Like I don't feel bad about the pain, but the pain itself hurts.
Well, in this class we can talk or discuss about theories, principle. We don't practice much, so that's probably best. Probably sometimes next semester, next year may offer the practical one, but at least it give you an idea. So yeah, even we have some kind of physical discomfort. If you try to let go of or refocus your mind different part of your body. It's making less tense. That's other ways. So depend. You have to be flexible with the techniques. Okay. So and again, we recognize, we know that mindfulness could improve our well-being, physical, mental, and behavior. That we discussed before. I just want to talk again. Okay, so let's move on to number 3. Okay, so what's meant by participatory medicine? What do you think?
Well, from my understanding of it, participatory medicine, I guess was more of not like taking like pills and stuff, as more as like you taking certain actions and acting certain ways to kind of relieve some of these symptoms of maybe psychological disorders or sicknesses. From what I read, mindfulness, in some ways surprisingly, but mindfulness has a better effect on relieving some of those like psychological disorders rather than physical ones. I mean, it's a lot of the time, I guess some of the physical illnesses can result in maybe a lot of tension and stress, which that is what indeed mindfulness can help reduce. So that can, I think, help reduce some pain in that way if you're maybe experiencing some pain. Let's see what else here. One thing the article I read did mention was by participating in what they call hatha yoga, this can reduce muscle tension, which lead to a reduction in pain. I mean, overall, I think, like I said, the main benefits of mindfulness tends to decrease disorders such as, like depression, stress, and anxiety. And this is basically just by decreasing the rumination that one has, because that, tends to lead to those illnesses there. So.
The definition of thank you. Participatory medicine has been a group.
How is it?
A group. Here, a group of people who suffer from chronic disease from communities together with the healthcare providers. That's what they call.
Together with the healthcare, what you said?
Here, so a group of people who suffer from a chronic disease or any kind of problems, even like if they have alcoholic problems, form a communities to share information and mutual support each other. Member of patient communities play important roles. Patient play a role as part of collaborative treatment team, address their problems, their disease, and they work together with the healthcare providers. For example, if you're sick, if you have let's say bipolar disorder, so you form a groups with a similar symptom people, and you work with your doctors and nurse how to find the best treatment for you, and you decide that too. Not regularly, right? You go to the hospital and the doctor and the nurse prescribes the medicine according to their diagnosis, right? But here is works in this traditional way, but on the top that the patient has the right to select out the best treatment for him or her. As a way that they work together with the physicians, with the doctors. That's what they call participatory medicines. Okay, so let's go back to, okay, here. A patient is mindful involved in treatment by making behavioral change, meditating, or similar act. So they incorporate, right, the holistic treatment as well as the traditional treatment together with the whole groups of this same and similar disease illness, as well as the groups of healthcare providers, the nurses, doctor. That's what we call. That's what's mean. Okay. Now, so again, the context and relevance of mindfulness in this participatory medicine again is similar. So they encourage each other to find the appropriate treatment for themselves, of course, with the advice from doctor or nurses. In the meantime, all of them involved in the practice of meditation, including doctor and nurses, not only the patient, but the doctor and nurses and all the patients in that groups. That's what they call here. And this one articles I put online, I think. Number 3. Anyway, all right here. Yeah, if you read this article, you read this article?
I actually read the one you just had highlighted before.
This one?
Yes.
Oh, probably. Yeah, this one?
Yes, sir.
Oh, okay. So this one here. That's what we call here mindfulness in particular medicine, context and relevance. That's what. Oh, that's fine. Okay, let's move on to the next one. Okay, describes how mindfulness-based can apply as a technique in dealing with people with developmental disability and their caregiver. Anyone does this? Probably Jessica, right? Is that right? Jessica, she wrote that article. Is what she was looking. Okay, let me show you this clip. It's a similar approach, but this you can see the clips better understand.
So it was the secret weapon that gave them the edge in last week's NRL Grand Final. Schools are using the technique ahead of the HSC. Mindfulness has also proved to be effective in treating anxiety, depression and bipolar disorder. Juanita Phillips reports.
So who's gotten in trouble before for yelling at somebody or for storming out of a place?
These Year 10 students had 2 years before they faced one of the most stressful events in a teenager's life, the HSC. But already they're boosting their mental health in preparation.
Rather than pushing this feeling away, it's about letting the feeling be.
Strong Minds is a program based on mindfulness. It's a modern take on the ancient art of meditation. It teaches these young people not to be afraid of difficult emotions like anger or sadness.
Everyone's going to have hard periods of time during their life, unless you can either have them early in your life, you can have them later. But if we learn it now, it's really going to help when people have them later on.
But it's the role it can play in preventing and treating mental illness that has medical experts excited.
So grab this, you can put the headphones on, and you can just sit and relax. Grab a Smartie and just hit play.
In this guided meditation using lollies, young people are taught to focus on the present moment.
It just guides you through being really present. That's what mindfulness is. It's just being really in the moment.
There's little doubt that the busyness and stress of modern life is a major contributor to mental illness. Practicing mindfulness mindfulness gives the brain a break, allowing it to find stillness. For reasons science is still investigating, this simple technique has proved highly effective in treating depression and anxiety, and to some extent bipolar.
Mindfulness will become mainstream. I think it's still in its infancy, unfortunately, here.
An Oxford University study found mindfulness reduced relapse into depression by 44% and was just as effective as antidepressants. A world-first clinical trial in Sydney found even people with bipolar disorder had a better quality of life after regular sessions.
I think because stress is such an important factor that underlies a whole range of different psychiatric disorders and exacerbates symptoms, I think that using mindfulness to manage stress is probably the way that we'll see more research going down that path. Yeah.
A simple concept in increasingly complex times. Juanita Phillips, ABC News.
Yeah. So again, this is something we discussed already, and even, what's meant by bipolar disorder? What's mean?
Multiple personalities, kind of.
Yeah, switching personality, right?
Switching gears.
Switching mood.
I think it's kind of crazy because people usually try to say, "Oh, are you being bipolar?" when you're just being moody, but being bipolar is a serious problem, and you don't switch in like a matter of seconds. I mean, it takes weeks or months for you to switch from the depressive state to the manic state. But that's something that always irks me is people will always say that, like, if you switch moods real fast, that's normal. You're just being moody. But it's just so irksome to me when people are like, "You're just being bipolar." Like, that's not something to joke about.
Yeah.
So that's pretty much best.
Okay. So that's a serious matter, right? When you switch personality, right? I have not seen that kind of people yet. So it's just in the matter, let's say, in matter of days or weeks, to change a personality.
In my abnormal psychology class, we learned weeks to months. So I guess things could be different, could be a little shorter. But it's not just like matters of seconds. It's not. There's a different disorder like that. I think it's called cyclic disorder, where you switch all the time. And bipolar.
So that person could not recognize how they change. Do they recognize or?
Well, my mom, I think she struggles with, I mean, it's not just bipolar. Usually if you have bipolar, you also deal with depression, anxiety, and she also deals with borderline personality disorder. These are all things that she's been diagnosed with. And I'm not a doctor, but I have a lot of opinions about her diagnosis. Because, the definition that you hear about bipolar disorder, it's for her, it's different. Like, she can just, something will trigger something in her, and then she will get very, very upset, and then she'll lash out, and like 10 minutes go by, and she'll calm down, and then she'll just come back and say sorry. And it's just like, it happens all the time. So the state, like the description of like months going by where it's like a gradual change, I don't really see that with my mom. I mean, she's also been told she has seasonal mood disorder. I mean, I do see that she has better mood in the summer, and she's able to move around more in the sunlight and everything. She gets more depressed in the winter. So I don't know if it's, when she lashes out or when certain behaviors occur, if that's bipolar, if that's depression, anxiety. It's like it's a whole
combinations.
That's how my brother is. He's just like that. Like, he'll be in a depressive mood, but sometimes he'll come out for just a minute, and then he'll like go back into it. But their diagnosis sounds really similar. He's the same way. Like, I don't know. He has several personality disorders, and he's bipolar, but he also has anxiety, depression, panic attacks, and he has like the same type of thing. And sometimes, he'll like lash out, but then he'll like go back into that main mood.
I think his diagnosis, it's like not a diagnosis. There's
spectrum in there. So DSM says it's like rapid cycling, inexpressive versus the ones who are both from most. So they change. It can be, it's based on the individual. It's not a set.
So how about let's go back to how could we define someone has some kind of mental illness? Is it serious? Is it serious matter? Right? What type of serious illness? I mean, the mental illness that some people have. It's bipolar. It's serious. Stress is not a mental illness. Everyone has stress, right? Mm-hmm. Okay, what else? What do you think?
Schizophrenia.
Huh?
Schizophrenia is another very serious mental illness.
What is that?
Schizophrenia.
Oh, okay. What's about?
It's like you either have delusions or you see things that aren't there.
Okay, I see.
What
they call hallucination, is it right?
You can have hallucinations, or it's like delusions, where you convince yourself that something is happening that's not really happening. So you don't have to see something that's not there, but you could hear something or just think that something's
you hear some strength, right? You see some strength into, right?
Like you convince yourself that you're like an astronaut.
Okay.
Like there's lots of different examples.
Okay. So for bipolar people, I think could you recommend your mom to sit in meditation?
Yeah. Yeah. We talked about it a lot before.
Oh, really?
She's gotten books, but I think she's relied too heavily on her medication since she's been diagnosed, and I don't see any change happening. Like she'll talk about it one day, and then she'll just forget that she bought a book on it.
Oh, really?
The next day, like it's just there's not much consistency there.
Yeah, for someone who has the illusion, right? Some voice, some strange voice, or see some strange image, vision, and so forth. I think in my own experience too, in mindfulness, if you really focus on your breath, that type of illusion, eventually, if you are attached to them, eventually they will be gone. So this everything starts from the mind, but that person needs to dedicate in the practice in order to overcome these type of problems. Otherwise, it's carry on the rest of their life. It's not easy. Okay, so again, this is the practice. Okay, let's just move on number 4 and number 5. Anyone does number 5? Is this one I get from this article is again relationship between mindfulness practice and level of mindfulness and so forth. We've been in MBSR. This. Have you seen this? I post all the articles on the canvas. Right. So again, based in this kind of research, they based upon what they call the 5 facets. Right. To determine the relationship between mindfulness and other well-being, observing non-reactivities in the experience, despising, non-judging of inner experience, acting with awareness, observing. I notice the smell and what's that? Aromas of things. Yeah, so observing, just recognize non-reactivities to inner experience. I perceive my feeling and emotions without having to react to them. This is important. Not to react. Most of the time, right? If let's say if you have the pain in the back of your neck, right? You're like, oh no, it's bad feeling, right? So this is ultimately we get that kind of habitual pattern. So here it reminds us not to react. This Bryson, I'm good at finding words to describe my feeling. It's just the ways how to recognize them. But if you really focus on your breath or meditation, you don't need to describe. This is you can say that the beginning stage, a beginning step. Now, judging of inner experience, I find some of my emotions are bad, inappropriate, and I should not feel them. So whether you have pain, discomfort, irritations in your body or your mind, just don't judge them. It's not easy, right? We used to judge. It's good, it's bad, I like it, I don't like it, I hate it, and so forth, right? Acting with awareness again, this is important. I find myself doing without paying attention. So we have to recognize them. Have to pay attention on them. With that kind of awareness. Okay? So they use this what we call 5 phases to recognize to recognize the relationship between the mindfulness. This is this so-called 5 phases mindfulness questionnaire. They based upon that kind of questions, that kind of phases, to find the relationship between mindfulness practice and level of mindfulness and so forth. How they connect with each other, and this is. And we come to the conclusion here. Change in mindfulness versus well-being, specific stress and symptoms. They recognize the change there. Let me go down. They have this kind of. They have the model, and they recognize the connection. They have recognized the connection between the levels of mindfulness practice, between the mindfulness practice and level of mindfulness. That's how you mindful, how you're aware of your own problems, physically, mentally, and you recognize some symptom, medical and psychological symptom, and you improve. Then they say they recognize this improvement in that type of mindfulness practice. So this is hard to follow, but that's the one of the research. Okay, so let's just move on number 6 then. This prize. Do you have this one? You have this?
But I didn't have time to do it because I got my record over the weekend.
What is that?
I got my record over the weekend, so I didn't have time to do it.
Okay, so what do you have then?
That was mine.
What do you have then? You have?
No, I didn't have time to look at it. So
okay. This is one article here. I know this. This one. Yeah, this one here. Have you read these articles?
No.
This teaching mindfulness to psychologists in clinical practice. And basically they examine the outcome to provide a mindfulness program for the mental health professionals, like therapists, psychologists, and so they recognize, they compare with the baseline score, the basic lines. That's been demonstrated the knowledge of persons or measures and risk mindfulness in clinical work increasing capacity to intentionally invoke mindful state of consciousness and higher participant rating of well-being over the course of training session. So they increase the therapeutic mindfulness in the study from change mindfulness attitude, and it's improved as opposed to it's improvement for them how to deal with their clients. So this article is give that kind of understanding. So anyway, who are you? Who are going to be psychologists? You?
Well,
Okay.
I would be a counselor.
A counselor.
Not necessarily.
Yes. So.
Well, I was going into neuroscience, so I don't have like patients, but.
Okay. So on the last question we talk about the burnout, right? Doctor burnout, even fresher burnout too, right? We talked about the power stress before. If you are in the position of leaders, teachers, a counselor, and so forth, there's more stresses than the patient, than the students. Yeah, we have to lead the people in the right direction. Anyways, in this article, if you read carefully, this article is talk about that kind of training, teaching mindfulness to psychotherapists. It's basically they put the guidelines that the psychologists need to follow. Let's say if they go through the MSBR program, 8 weeks programs with 2 hours and a half per day, and they could recognize the improvements of the therapist. If you are a therapist or a psychologist and the patient walk into the room and you're nervous, right? If you're nervous, if you have so much things to concern in your mind, like in your personal life, for example, it's not much offering for you to the patient, right? So that means you, at least as a therapist, a psychologist, or counselor, you need to have that kind of calmness qualities. Otherwise, it's not easy to handle the patients. And even if you run a business, right? If you're a leader, we talk about that, right? If you're a leader, if you're in business, if in any position, if you lead other people, if you lead, teach, or guide other people, you need to have some kind of calmness, some kind of wisdom to deal with them. Otherwise, if you don't have that kind of calmness or peacefulness, when they come to see you, right? In your case, if they know that you're a counselor and they approach you to ask for advice, but you don't have any kind of peacefulness, calmness in your mind, you may not know, you may not be mindful with their problems. How much more you offer the treatment or guidance for them. So that's why this teaching mindfulness, training mindfulness to the psychologist and so on. Okay, so be careful about this article. Okay, so the next one, the number 7. Yes. Okay.
Okay. So I looked at the PowerPoint, mindfulness in primary care, and it seemed to be focusing more on the patients and how mindfulness helps patients. And I feel like we've talked about that so much in here that it would be somewhat redundant. So I was I thought that the question was looking at mindfulness in a hospital environment or in primary care, like for the physicians. How will it help the physicians and doctors? So that's what I looked at, and that's what I was trying to find.
Can you define what's mean primary care about?
Primary care?
What's mean?
I mean, like the physician you go to, like when you're sick, or
family doctor.
Family doctor, yeah, exactly. So I found an article not under Good Files. What I did find under Good Files were it was just reiterating how you can use MBSR, MBCT, ACT, and DBT for mindfulness. And the article I found was helpful because it was actually in like a nursing academic journal, and it was talking about how important it is that nurses delegate certain jobs to unlicensed people working in the hospital when they need help, and how important communication is. And the article talks about mindfulness and how you can use mindfulness to improve delegation and communication, since a hospital or a physician's office is typically an environment where there's so much information going around all the time that if you miss things and if you're not aware, then you can make mistakes quite often. And if you don't trust that other people can make certain decisions and you don't delegate, then only certain people are getting the job done, and it's very, very stressful. So the article talks about 3 things: information quality, mindful communication, and mutual trust within the relational context of the delegation. And let's see. I'll just read one quote, and then this is really all I have. I don't have much. So Langer, who is one of the people who conducted research, Langer has asserted that mindfulness related to a state of alertness and active awareness of everyday tasks is continually analyzed and categorized. It allows for dynamic and transparent information processing, distinctions that allow for new interpretations to emerge, and an awareness of multiple perspectives.
Okay.
Is that what you were looking for?
Yeah. Yeah. We know definition of primary health care. This one here, right? Primary care. Go to specialist to the hospital. Have you been hospitalized before? So it's expensive, right? Yeah. Okay. I used to tell a story. There's a gentleman, he's in his 30s. One day he worked with his wife in nail salon shop, and one day he asked his wife to call 911 to get ambulance to bring him to the ER room. So yeah, they did. And when he got there, the doctor could not find anything. He couldn't find anything wrong. And so later on, the doctor talked to him and found that, well, because of the stress, he thought that he has heart attack. You know why? Because his father passed away because of heart attack. When he's so stressed out, he thought he has that kind of symptom, that kind of problems like this now. Some people, they may be healthy, right? But they don't recognize the state of mind, especially the elderly people. You know, right? And they like to go to see the specialist, or they want to go to ER or hospital because they think they're so serious. So basically, it starts from their mind. And of course, unless it's something urgency, right? Unless someone break their bones, it's bleeding and so forth. We need that kind of urgent care. But most of the times, it may delay to our mind, to the state of our mind. So primary care with the practice of mindfulness. Let's say if you feel something that Tylenol and aspirin could not help. Sometimes, in my case, sometimes I sit down and meditate for a while, even I know that medicine could not help much. So sometimes it's work. So depend upon how much effort you put in the practice. So that's why mindfulness is so applicable and so useful, and it's less expensive, right? So usually when you go to the hospital, especially ER, they charge at least $500. So right, more than one day in the hospital may cost more than $1,000. Is that right?
Oh, easily.
Easily.
Yeah. Oh yeah. Depends on what you're there for. What kind of tests they run, what kind of medicines they give you. Like my husband was there just for 4 hours, and it cost us $6,500.
My stepdad didn't even go to the ER. He went to the after hours connected to the ER when he was out of state once because they thought he had West Nile. He was working out south. It turned out to be another thing like that. But yeah, he was only in there for a couple hours and got like an antibiotic shot and some medicine and went home, and it was like $6,000. And it wasn't even in the ER. It was in the after hours care next to the ER. Yeah.
How about, have you been in ER? How much did it cost you?
I had insurance.
How much?
I had insurance.
Oh, okay. But you know?
That was a lot, I'm sure.
Really? You were in ER?
I had insurance too. They were just like stitching up my face after a car wreck. But
oh, really?
I forgot how much the bill was. I think it was like $3,000 or $4,000. And I spent like 5 hours in there, but 4 hours of it was waiting in the waiting room, like with a gaping hole in my face. You could see this part of the bone.
Oh,
I
really?
just had a tissue right here. And it took them 4 hours to get to me.
And fortunately, you have the insurance to go for, right? Otherwise, it's huge. Yeah. Okay.
It's interesting. Like, I read the Message of Social Justice and other things in the PowerPoint.
This one?
Well, in here you had something about poverty and the pure talking about medicine and social justice with people who don't have insurance, who are very poor. Mindfulness would be good for. It's not going to cure everything, but it'll help alleviate the symptoms.
Yeah. So go back to my question is as have you ever had the experience that somehow you have the urge to go to the hospital instead of going to see your family doctor? No? What's that?
Well, like just this summer, I remember I was sitting in class, and then have you ever had the like eye floaters before? They're just like little things you can't look directly at. And they go away after 20 seconds, but this was like a big one, and it never went away. So I went like straight to the urgent care because I was freaking out about it. But they just
what happened? What's that?
It's just like something gets in your vision because a piece of, I think it's like a piece of the back of your retina broke off, and it's just floating around in there.
Oh, really? Is it flying to your eyes?
What?
Is it flying to the object flying to your eyes, or what?
No, it's something inside your eye that the light's hitting, and you're seeing the shadow of it. It doesn't really go away. So I went to the doctor because I didn't know that, and I thought it was a parasite. So I was in the hospital, and I was like, "There's like a worm in my eye, please." And they were like, "No, there's nothing in there."
Oh yeah, yeah. One thing I forgot to mention the virus now, right? The Ebola virus, right? Here we don't have anyone to work in hospital or clinics, but this scare people now, right? If they visit the hospital, I have a family. I got back from Houston, and I know a couple who has a son who is doctor in Dallas. Many of his patients don't dare to come to his office anymore because of this kind of virus. it's spread, and this is scare a lot of people. And even now, they in the public place, right? In the public transportation, the bus, airplane. You read the story, right? They isolate the people that they have they suspect that they carry that kind of Ebola. Again, so sometimes we concern much about the problems that it may be untrue, and it starts from the mind. So when we calm our mind, we can recognize what kind of problem is that. Otherwise, it wastes our money and our time too. Right? Okay, so wow, most of you like the last question, right? Okay, burnout. Describe how mindfulness help healthcare providers to manage burnout, stress, anxiety. Again, if you counselor, if you psychologist, yes. Yeah. Okay. Go ahead. Yeah, please.
No, you can go first.
No. That's for you voice. Yeah, for you.
I didn't know if you knew I did.
Yeah.
Okay, so I wrote about this one, and healthcare professionals face a lot of potential stressors. They deal with patients that are physically ill, and with physical illnesses come emotional issues. And the healthcare providers by default going to have to work with patients' emotional stress of the illness, even if they're not necessarily trained to deal with emotional stressors. If they're just trained to deal with the physical, if they're a nurse, they're checking you in, they're getting you through, that's what they're trained to do. But they also have to deal with the emotional state of the patient, even though they may not be trained to do that. So that might make it really challenging for that healthcare provider. And then you have the types of healthcare providers that deal with people who are, like terminally ill, or really sick children, or terminally ill children, elderly people who probably they're gonna pass away. Those types of things increase the emotional stress on the caregivers because they know that the person probably won't make it. Or in the case of a child, if the child doesn't make it, it's really much more challenging because you expect that they would make it. So if you add all that on top of normal job stresses, everyone has the job stresses of poor management, bureaucracy, administration, office politics, interpersonal work relations, high workloads, tight deadlines, lack of training, or understaffed environment where too few people are taking on too much work. Those are all normal job stresses that everyone has to deal with when they go to work. And they increase and decrease depending on the type of job you have. But all the healthcare professionals are experiencing those, plus the emotional strain of their job. So I think that it puts them in a higher risk for different types of burnout and anxiety and stress. I think that problems get really bad when there's strong attachment to their patients. And it's hard, I'm sure, for a lot of people to not be attached to their patients. Because part of the burnout is when they detach themselves emotionally from everything because they can't be attached to their patient. That's one of the symptoms that they're having burnout. Mindfulness has been shown to help reduce the reaction to the stressors and therefore the risk of burnout. The most effective solutions that I researched were when the administration of the hospital were involved with the stress reduction type of campaigns, where instead of only the nurses or doctor or the staff being mindful, yes, a person in healthcare should definitely practice mindfulness on their own, right, to help them, observe their emotions and do all the things, stay in the present, not get too attached, and all these things. But it's much more helpful when the entire hospital embraces the concept of mindfulness, because then if management's involved, they can start reducing the other issues like the bureaucracy, poor staffing, dumb politics, things that don't help. If you're mindful about how you're managing your staff, you can cut out things that are causing stress that don't need to be there. And also you can have mindfulness programs that provide time and a place for your employees to take time out and meditate if they need to, or even guided meditation, especially in a hospital setting. It should be especially easy to have a guided meditation setting because there's psychologists and different people who should be trained to do this on site. Another thing they suggested was for people who are some of the techniques that could be used for people who are dealing with people who passed away, patients that they've lost, would be not only your mindful walking, meditating, journaling, deep breathing, and then attending memorial services of the deceased patients. Just something that I don't think a lot of care people would think to do. But like, if you know them and you're close to them, it wouldn't hurt you to, join their family, be supportive, grieve with them, and allow yourself to grieve and then move on, type thing. Because otherwise, if you're building up all these losses and you're not allowing yourself to grieve them, I think that would cause burnout too. I personally have never worked in the hospital or healthcare field, but I've taken care of my own family when they're sick. So I found with that type of environment, you end up being really tired because you typically don't really sleep a lot when your family is sick and you're trying to take care of them, because they're usually sick all night long instead of all day. They usually are sick all night and then they sleep all day and then you have to go to work. So I find that to be especially stressful, and I just really feel blessed that none of any of my families ever had like a long-term illness, because I think it would have been really, really hard to deal with, because just short-term illnesses are extremely stressful, because you can do so much and then you just kind of have to sit there and watch them suffer until they're better. Like really, somebody's getting sick, all you can really do is hold a bucket for them, give them a washcloth. You can't really ease how they feel, you just have to let them be sick, and that's really hard if you care to how they feel. It's hard. So I imagine someone in a healthcare field would have to struggle all day, every day with that type of thing, and that would be very, very difficult without some sort of mindfulness or intervention on your own.
Remember last semester when you have the Buddhist class, this a lady, she worked in the hospital as a nurse. She said that because of the pressure, she needed to take care of many patients at a time, run here and there, to take care of them. So how could they apply mindfulness in the work?
Yeah.
Because of that kind of pressure.
Fast-paced,
yeah, fast pace. In this happen in any profession, right? At your work, right? Workplace or human, in the restaurant, and so far. Even in school, you rush into the next class.
Everything's really fast-paced. You're trying to do a lot with a little amount of time.
Yeah.
And I think if I was in healthcare and you're faced with those types of things, you still have the same deadlines, because you have a hospital full of patients, right? You have to run to the next. You probably have to deal with a lot of feelings of guilt for not giving them the care that you want to give them, right? You really know that they need about 20 minutes of your time, and you have maybe 3 or 5 to give them. And so then I would be like feeling very frustrated that I didn't have more time to spend with that patient, because I would feel like I was treating them and not doing my job well, and I would feel guilty that I'm not doing enough for them. But then how do you spend 20 minutes there when you have 20 more patients? I imagine that's very stressful.
Like if you work in a restaurant, if you bring the wrong food, you can change that. All right, but if you give wrong medicine to the patient when they have taken the medicine into their body already, it's not easy to push it out.
One of the suggestions was that if it's like a nurse, if they're real busy like that, to just before they enter the next room, to stop and just do like 3 or 4 breaths, just a few, just to refocus before they enter the next patient, even though they only have a few minutes. 3 or 4 breaths is only a few seconds, and it might help you focus yourself before, so maybe you won't make mistakes and stuff like that. But my job is like that. It's super crazy, always bam, bam, bam. But nobody's life is affected if I mess up something, right? It's not going to hurt anyone. Like, so I don't have to feel guilty if I don't send this email on amount of, fast enough, or I forget to tell somebody something. I just do it when I remember and move on. But like you said, if you do something serious, then that's really bad. So
but even in your job too, if you are not mindful with your email, you send a wrong message to your manager, it may cost their job, right?
Well, yes. I always reread my email.
Yeah.
And if I'm upset, I have someone else read them
before good.
To make sure. Because
Okay, Stina, you want to have something to add?
I wrote about burnout in mine. And I just wrote about how a good definition is a stress symptom felt as emotional exhaustion contributed to by a large number of factors. So what we already talked about, there's so many things to be stressed about in the healthcare field, but you can feel burnout in any job, and I wrote about this one because I've been really burning out lately. I didn't really realize it until I started reading all the symptoms. I'm like, yeah, that's exactly right now. And then there was an acronym that I thought was really useful. It was for the word learn, and the L stands for listen to the patient's perception of the problem. E stands for explain your perception of the problem. A for acknowledge and discuss the differences and similarities between your perceptions. R, recommend treatment, and N, negotiate an agreement, because a lot of times when healthcare providers get burnout, it's not that they stop caring about their patients, it's just they don't have enough cognitive and emotional resources and energy left to care. It's like they can't connect with their patients anymore and really listen to what they're saying. They just get the attitude like, well, I'm right, I'm the doctor, you're wrong, you're going to do what I say, and then sometimes the patient feels upset about that, so they won't take their medicine, or they won't try to eat healthier and lose any weight. They don't listen because they're not understanding why they need to do that. So I thought that mindfulness can help with that, because it helps you develop like a switch in the back of your head, which I tell my boyfriend he needs to have too, because he works in a prison, you know. So you need to have a switch. You turn on when you go to work, and you turn off when you go home.
Wow.
You leave your work at work, and you come home and you have your regular life. And when it's time to go to work, you flip it back on, because if you bring your work home, you're gonna have problems like we have problems. Sometimes I have to remind him, I'm not an offender. You cannot talk to me like I'm one of them, okay?
Wow, that's
and
good.
And he feels really bad. He's like, I'm sorry, I don't mean to do that. So I feel like sometimes, you know, healthcare providers might have the same thing. Obviously, they're not usually dealing with criminals, you know, that kind of thing, but...
I'm not an offender. I'm sorry. You say I'm not an offender.
That's literally what I say.
That probably does the trick.
I literally have to be like, I'm not an offender. Like, okay, I'm sorry. Because, like, sometimes, like, he has to be really bossy and really firm and stern and harsh with them, because most of the time, if he has to reprimand them, it's over something really serious. And so, like, sometimes he's just telling me something little, and he says it in a really rude way, and I'm like, nope, hold it. You need to flip your switch off. You're not at work anymore. You're home. So I think that that's something that they need to learn too.
They should have mindfulness for like after work, where he can just go into a nice room and they can meditate and then leave. And
well, they have like a gym and stuff, and I've talked to him about it. I'm like, why don't you start running again or lifting weights at work again instead of at home? Because I work out at home, but like if they have a free gym, I was like, why don't you go start doing that after work? And I've been teaching him the mindfulness techniques, and it does help him a lot to de-stress
all out before he gets home.
Yeah, because he can't talk to a lot of people about it, because until you work there, you don't understand. It's an open cell prison. I mean, everyone just walks around with you, 300 men at a time. And, you know, when we go in public now, like, we have to sit in the corner in the restaurant. Like, his back has to be to the wall, because he can't stand people walking behind it. If we're in big crowds, he cannot stand it. He starts having an anxiety attack, because if somebody bumps into him, you know, like, he just can't stand it. Because when he's not in prison, he doesn't have any control in regular life. Like, he can't boss people around in regular life. So I've really had to teach him a lot of this stuff. I wish he could be in the class with me. I told him if he ever goes back to school, he needs to try to take a class like this.
So you're going to be a counselor. What happened if one day you burn out? How could you handle that kind of situation? If you burn out, you see so many patients that line up out there to wait for you.
Well, the main thing that I wrote about in this is the main thing I thought would help me too, is just separating yourself from your work. You have to realize you are not your work. If someone asks you to, you know, tell me about yourself, then the first thing people usually say is their career. They usually just identify with that, and then they'll talk about their job, and then that's it. They don't talk about, well, what do you do besides that? Oh, well, I like to read, and, you know, I like to do yoga, I like to bake cakes. No, people usually don't say that. They just talk about their work, so you just need to separate yourself from that.
Don't take it as personal, right? When they dump all kind of the stress on you. all kind of mental garbage on you, right?
Yeah, I already get it all the time, so I can't imagine what it's going to be later, but hopefully I'll have a lot more training by then. So.
Sure. You have anything to say about this?
Well, I did number 7.
Oh, which number you have?
7.
Oh, 7. We skipped you.
Yeah.
Oh, sorry. Yeah, we can come back. Yeah, sorry. Go ahead.
Well, I feel like I should have done what she did and look up like how the physicians feel about it. But I did in the reading, it mostly talked about like what they would use on the patients, and it said they would use what we've already talked about, which is MBSR, MBCT, DBT, and ACT. And then it just described those, and it said that it could be useful in treating things like anxiety, asthma, cancer, chronic pain, coronary artery disease, depression, diabetes, fibromyalgia, and other stuff like that, which I found surprising because those are all physical ailments. But it talked a lot about doing a body scan before you go directly to the hospital. Just calm down, meditate, and try to find what it is that hurts. And it said mindfulness can help with your pain tolerance, but just trying to suppress your pain. Sorry, my throat hurts. It's hard to talk. Just suppressing your pain could actually increase it. And then it said you could do, as well as the therapies, but you could do hatha yoga, sitting meditation, and walking meditation to decrease your pain.
Okay. Let's go back to the thing that you just mentioned, like we discussed recently. Let's say when you have, let's say, headache or stomach problems, probably because of your stress, anxiety, right? Sometimes your brain trigger that kind of pain, right? That kind of problems, right? So you have that kind of experience?
If you stress from anxiety, yes.
Yeah.
I've done that. I've had headaches, neck aches, stomach ache, backache from anxiety. Yeah, just from stress. You can easily.
That's why we need to cool down at that moment. Yeah, that's just even sometimes you have, let's say, presentation. You freak out, you so nervous, right? But you may calm your mind probably a couple of minutes before, 10 or 5 minutes before that kind of presentation. It will be helpful. Okay, let's. We have time. Let me show you a brief. Clips how mindful training prevent doctor burnout. I talk with many doctors. They say depending on the state. Some state may require doctor to buy malpractice insurance. It's pretty expensive. So that's why. Actually, one of the reasons why they have that kind of insurance. Otherwise, if they make mistake, their license may be revoked.
That's part of the reason they have to see so many patients. They can't cut down and see. That's why they double book in case somebody cancels. Yeah. They have somebody in that spot because they need the money, they need the income to cover all their staff and their insurance costs.
Okay, let's just.
Hi, I'm Nancy.
I like to move this. Yeah.
Surgery yesterday, so I stayed.
Let me go back a little bit here.
Yeah, we face every single day during our training here because to be a good doctor, the good ones are the ones that stay late, work hard, and do the things and push harder that other people aren't willing to do. And that really conflicts with the new, awareness that people do make mistakes when they are tired, when they're exhausted and overworked. So I'm glad it's getting the attention it deserves. And
interested to see what this talk has to offer today.
I know, and it's interesting because I'm going to guess you're joining us from work, right?
Of course, as usual.
As usual, and how long have you been there today?
Well, that's an interesting question because, there are, I'm not going to say I'm one of them, but there are residents that lie about their hours so that they can participate in the cases they want to be in. I wanted to do a big surgery yesterday, so I stayed, and I got home at 11:30 p.m., and I was back here this morning to round at 6 a.m. And I live an hour and a half away from work.
Oh my gosh! That was actually more complicated than I expected it to be. Dr. Gangley, are you surprised though? I'm sure that you have experienced similar hours.
A lot of this sounds familiar. I'll tell you, I got into work at 6 p.m. yesterday and got home a couple hours ago and just took a little nap before coming in, so I feel it as well. I think I would agree with what you just said in terms of the distinction I think though between burnout and just being tired and the long hours of residency. I think
you can watch it home your spare time. Let's move on to the next one. I think today, since we are not healthcare providers here, right? Somehow it's not easy for us to grab the idea, but at least we know this here. So you see, we cover many aspects of life, especially in the healthcare. And next week, this Wednesday, we will talk about how we apply mindfulness awareness in the hospice. You have any grandparents, parents who stay in the nursing home?
My mother was in hospice for a year before she passed.
Okay, let's us. We have only 7 numbers, so okay. We'll do number 1. Describe the course of care patient. Okay, Tina.
Does that mean like the cost, like to you if you're their caregiver?
Yeah, you're a caregiver. Yeah.
Like emotional.
Yes, yes. Number 2, please. Yes. Okay. Yes, 3. Okay. 4, please. Yes. 5. Okay.